Hello, everyone. Thank you for tuning in to the Mayor's Pre-Summit Conversation Series. My name is Lisa Torres, and I'm the Program Manager for the Quality Improvement Network at the Office of the State Superintendent of Education. On September 15th and 16th, Mayor Bowser will host the 4th National Maternal and Infant Health Summit, and we're excited to highlight the importance of early Head Start programs such as the Quality Improvement Network and infant and early childhood mental health programs such as the Department of Behavioral Health's Healthy Futures program, both which serve to provide family-centered services to families with very young children. For more information about the summit and to register, please visit dcmaternalhealth.com. I'd like to introduce our guest for today, Michelle Reuter, Senior Project Director of the Quality Improvement Network Hub at the United Planning Organization, Monique Douglas, Early Childhood Intervention Supervisor of the Healthy Futures Program, and Stephen O'Connor, Branch Chief of the Healthy Futures Program. Thank you all for joining me today to share our agency's efforts to promote the development of children and supporting families in their roles as primary caregivers and their child's first teacher. The Quality Improvement Network is an early Head Start program that provides family-centered services in the child care setting that promotes the physical, cognitive, social, and emotional development of infants and toddlers while assisting families in meeting their own personal goals. In a collaborative effort, the Office of the State Superintendent of Education works to build sustainable, high-quality early care and education programs, support child development by engaging and empowering families to reach their goals, and acknowledging families as their child's primary teacher. The mission of the Quality Improvement Network is to build the supply of high-quality, comprehensive early childhood development and family engagement services for infants and toddlers. The Quality Improvement Network has 6 program goals focused on health and safety, workforce development, family engagement, quality standards, comprehensive supports and services, and staff health and well-being. By participating in programs like the Quality Improvement Network, children and families benefit from supports with eligibility, recruitment, selection, enrollment, and attendance, or ERSIA for short, family engagement, education and child development, comprehensive supports and services, all which serve to enhance the physical, social, emotional, and intellectual development of participating children. Michelle, the United Planning Organization serves as the hub for the Quality Improvement Network and is responsible for the implementation of Early Head Start within our participating child development centers. Family engagement is a large cornerstone of our program. What can families expect when engaging with the Quality Improvement Network?
Part of the United Planning Organization's team consists of dedicated family engagement specialists that work very closely with families at the start of enrollment to the end of the school year. Our FES, as they are often referred to, work with families to assess needs through the Family Needs Assessment, which is completed 3 times a year with the family to further identify strengths and needs. Through the assessments, the FES and the parent then develop a family partnership agreement where they collaborate in developing goals for the family and school readiness goals for the child to support in growth and development throughout the school year. Parents are also supported in obtaining various community resources to better support the family as a whole throughout the program term. Our goal through these services is to ensure that the family is an active advocate for their child and the community.
I mentioned earlier that the Quality Improvement Network recognizes families in their role as not only a caregiver, but also their child's first teacher. What efforts are made to support education and child development?
Well, another component of our team is our early learning specialists. They work very closely with the Quinn classroom teachers and the center directors to support with the classroom environment and the implementation of creative curriculum. which is the research-based approved curriculum for each of our centers. They also coach the teachers in completing annual developmental screenings and developing lesson plans. Our ELS also coordinate to analyze the child outcome data 3 times a year to support in continuous program growth. In addition, it is our goal to support the centers with individualization strategies for all of the children we serve, but also children that will be transitioning during the year, whether it be from classroom to classroom or to the next level of education, and also children with developmental delays and disabilities. This means that children in our program will receive high-quality learning environments, individualized care, and the support needed to help them grow at a developmentally appropriate level.
Families juggle so much serving as caregivers, teachers, and providers. The Quality Improvement Network helps families with comprehensive supports and services. What does that mean for families?
In addition to our family engagement and early learning teams, our team also consists of a program intervention manager, health specialist, nutrition specialist, and a facility specialist. Each of these comprehensive staff work to contribute to the program and each family's overall health and safety. Some of the additional services rendered through the QUIN include developmental and social and emotional screenings, sensory screenings, nutrition assessments, monitoring of the status of well child care provided by the child's medical home and healthcare provider, and supports with mental health. We are also required to complete 2 home visits with the family per year. These can take place at your home or at a community site. Home visits are important because they help us to improve family relationships, advance school readiness, and improve child outcomes. We truly love our families and we want them to know that we have many content area experts here to support them.
Earlier, we mentioned that the Quality Improvement Network is a family-centered program with services delivered in the child care setting. Our participating child development centers serve as partners in our program. What is their role in the Quality Improvement Network, and what can families expect when enrolling their child in a participating child development center?
Our child care partners, often referred to as CCPs, are one of our greatest assets as they are the first source of contact to our families. We work closely with many highly qualified childcare programs all over the district to ensure our program continues to thrive. Each center has a dedicated QUIN team that works individually with them to enhance their teaching practices and support them in individualized training opportunities. All of our components work together to improve their facility, their teaching practices, and their overall center policies and procedures. We truly work hand in hand with them to adhere to the local licensing requirements and to the federal Head Start performance standards.
Speaking about enrollment, is there eligibility criteria that needs to be met in order to participate?
There are a few steps for us to determine eligibility. First, we must verify your child's age, as all participants of the QUIN must be under 3. This can be done by reviewing the birth certificate. We also must review proof of residency, as you must be a DC resident in order to participate. Lastly, we require proof of income. Once these 3 components are reviewed, then we review categorical eligibility. Early Head Start, or EHS, categorical eligibility is then determined if the child is homeless, in foster care, or has a disability. In addition, a child can be eligible if the family receives SSI or TANF. Subsidy categorical eligibility is then determined if the family is receiving TANF and participating in an education or training program through an IRP, is a teen parent working towards their degree, or a non-TANF family pursuing their education to continue to improve their employment. Income eligibility is usually determined through various documents, including the parent's tax forms, W-2, TANF or SSI documents, or pay stubs. For parents that are unemployed, we request either a letter from the last employer, notarized statement of zero income, or an admissions form from the Department of Human Services. Then, all the previously mentioned steps are then verified by an in-person interview, usually with an FES or a center director. Lastly, we also oversee attendance of each child in the program. To ensure the safety of the children in the program, we request that center staff contact the families when a child has not arrived at the center within 1 hour of opening, if the parent has not reached out with an excuse for the child for the day. Also, if a child has not been present for 3 days without an excuse, a meeting will be scheduled with the family and an attendance action plan will be developed. We do this to address any hardships the family may be facing and make attempts to address them, while also encouraging continuity of care and fostering the importance of routine for the child and family.
Thank you, Michelle, for sharing information on the Quality Improvement Network. Now, let us hear from Kashan, a former Head Start student, Head Start parent, and current Head Start teacher.
My name is Kashan, and I was born and raised in Washington, D.C. And I started Head Start as a 4-year-old in 1977. My memories of Head Start always creep back. I remember coloring and singing and dancing. And I remember that my Head Start teacher had the same last name as me. And I grew up and had children when we got to Head Start. My daughter was 4 and I had left an abusive relationship. I had to kind of pull myself together, having left with just a suitcase. I knew that violence wasn't healthy, and I knew that my children were better off seeing me happy and whole, because that would give them permission to be happy and whole. When we got to Head Start, I was brought in, okay, your kids are going to come to school, but what do you need? Do you need job training? Do you need medical care? Do you need mental health care? All of which I did. And it was really there that I began understanding this holistic approach to taking care of children, where you can't care for a child outside the context of a healthy family relationship and a healthy school family relationship. I'm a Head Start teacher now. It's where I started my own education and learning to be happy and whole and free and love books and love singing and being silly and imaginative and think. I went back. And I don't have any plans on leaving because, Head Start is home, I guess. I don't know how else to describe it. Head Start is home.
Wow, it's so wonderful to hear the impact that Head Start is having on families in the district. To receive support enrolling your child in a participating child development home, connect with Easter Seals at 202-507-0664. If you're interested in receiving support enrolling your child in a participating child development center, connect with the United Planning Organization at 202-238-4509. Thank you, Michelle, for joining me today to share information about the Quality Improvement Network. Now I'm happy to introduce Monique Douglas, Early Childhood Intervention Supervisor, and Stephen O'Connor, Branch Chief of the Healthy Futures Program. The Healthy Futures Program serves as an agency partner to the Quality Improvement Network, supporting the social and emotional health of children, families, and child development staff through their infant and early childhood mental health consultation. Stephen and Monique, thank you for joining us today.
Hello, my name is Stephen O'Connor, and I'm the Branch Chief of the Healthy Futures Program with the Department of Behavioral Health. Healthy Futures is an infant and early childhood mental health consultation program that works in partnership with child development centers and home providers in promoting the positive development of social and emotional skills. We are often asked how we define infant and early childhood mental health, and Alicia Lieberman provides us with this clear definition that mental health for young children means the capacity to regulate emotions and recover from dysregulation, engage in trusting relationships and repair conflict, and explore and learn and cope with frustration. all in the context of the family's social and cultural values and expectations. Our main focus at Healthy Futures is working with young children birth to 5, learning developmentally appropriate social and emotional skills that will give them the best chance at success in school and life. What young children learn in these formative years will stay with them in one way or another for the rest of their lives.
Good day. My name is Monique Douglas, and I am a clinical supervisor for the Healthy Futures program within the Department of Behavioral Health. I've been with the program since the beginning of the Healthy Futures program, which was established in 2010, and I provide supervision and support to the current team. I now will go into the Healthy Futures model. Healthy Futures has been in existence for the past 11 years. It's been our pleasure to partner with the OSSI's Quality Improvement Network, or the QUIN program, in bringing our services to those centers and homes that are affiliated with the QUIN. We have formed positive relationships with our center directors, childhood educators, and families within the child development centers and the home providers within the District of Columbia. Our consultative services are an embedded model where we provide consultative services on a weekly basis year-round. Consultants can also be at a center for a half or full day. While working from the programmatic classroom consultative stance, our consultants continue to build on forming relationships with the center directors as well as the teachers within the classroom. Consultants have the joy of engaging with children during circle time. They model specific interventions for the teacher/children and encourage teachers to engage with the children from a social and emotional lens. Examples of services can be from encouraging pro-social skills, how to express feelings, and problem solving. Consultants also provide a variety of classroom interventions/strategies to help with classroom management and behavioral concerns. Lastly, the consultants also provide professional development workshops around what is social and emotional development, how to work with challenging behaviors, how to take care of yourself, just to name a few. Consultants under this type of consultation works heavily with the teachers, parents, QUIN coaches, and the family engagement specialists to meet the specific needs of the referred child. Parents meet with the consultants at the centers or via video conference to discuss specific needs of the child or to obtain assistance from our partners. Strong Start or early stages if concerns arise and early intervention services are needed. The consultants can then ensure that referrals are streamlined and linkages occurs in a timely fashion.
In a 1995 groundbreaking study, doctors in California found that there's a powerful connection between early childhood trauma, like physical and emotional abuse and neglect, and poor health outcomes later in life. Health outcomes can include increased risk in heart disease, diabetes, obesity, depression, substance use disorder, smoking, and poor academic achievement. This study, known as the Adverse Childhood Experiences Study, or ACEs, shows us how important healthy relationships and a healthy environment is for the positive development for infants and young children. We can help promote resiliency in young children by focusing on healthy caregiver and child relationships and teaching pro-social and emotional skills.
Tucker the Turtle is an intervention tool that the consultants use to assist children with problem solving / self-regulation concerns. Tucker has a problem and began to act out and hit his friends. He then begins to get angry and is then told how he can take 3 deep breaths and go into his shell and relax. While in his shell, Tucker is self-regulating and thinking of better solutions to engage with his friends. Once he is ready to come out of his shell, he can then come out and play with his friends. Another intervention our consultants use is the Kimochis kit. Kimochis means feelings in Japanese. A quote from the Kimochis website is, "On the surface, we're a family of cuddly critters in a big bowl of emotions. Underneath, we're a proven system for helping kids grow and transform by dealing skillfully with their feelings." End quote. Kimochis is a 5-minute lesson. It can be reinforced naturally throughout the day, and it reduces referrals and disturbances and increases engagement. And we really work with our teachers and we model the Kimochis kit and the interventions with our children, and the children love the different characters that the Kimochi kit brings to the classroom. Another intervention we really try to use within the classroom is the conscious discipline model. The conscious discipline model is another preventive resource that the consultants use while in the classroom. The focus of this intervention is guided on thoughts, feelings, and behaviors. Within the conscious discipline portal, the consultants utilize the feeling charts, stories to promote social and emotional learning. They discuss trauma work, and they also work through many other self-regulating tools within the system to assist with challenges when they arise in the classroom. And we strongly recommend conscious discipline to the teachers as well. The parent cafes. While continuing to form relationships, we understand the importance of parents to have an outlet to obtain support and to work through concerns with other parents. Healthy Futures continues to join with OSSI and the Quinn program to implement parent cafes. The focus of cafes is to allow parents to come together and to work through the 5 protective factors outlined by the program. The 5 protective factors are resiliency, relationships, support, knowledge, and communication.
For more information on the Healthy Futures program, please contact me, Stephen O'Connor, at 202-527-0840 or at stephen.o'connor2@dc.gov. Or please reach out to one of our 2 supervisors, Monique Douglas or Angelica Clark Brown. Thank you.
Thank you, Stephen. Now I invite our presenters to share final thoughts.
Thank you for allowing us to join in the discussion around our services on social and emotional development. I welcome you to reach out to the Healthy Futures team at your child's center. If you do not have a center with a consultant, please feel free to reach out to the DBH's Access Helpline at 1-888-7-WE-HELP to be linked to a clinician in your child's age range. Thank you for your support, and we look forward in talking with you soon.
The early years in a child's life are a time of amazing changes. Learning these social emotional skills and promoting positive mental health gives a child the best opportunity for a happy and successful life. And parents, we have not forgotten about you. Please join us on Wednesday nights for Wellness Wednesday from 5:30 to 6:30. Visit us at the DBH website for the link. Thank you.
Thank you for allowing me to join and talk about our program. The goal of Early Head Start in the Quinn is to be a comprehensive program that is not meant to be intrusive, but a support to our community. We aim to support our families through each of the services we offer and to encourage best practices in our childcare settings. Please share our message with your friends and family and to anyone that you think could benefit from not only childcare, but our comprehensive services. Please call us at 202-238-4785 to inquire about enrollment. I want to thank Michelle, Monique, and Stephen for today's discussion and the information and resources provided. As a reminder, be sure to visit dcmaternalhealth.com to register for this year's National Maternal and Infant Health Summit, which will be held September 15th and 16th. To learn more about the Quality Improvement Network, visit us at aussie.dc.gov/Quinn. And to learn more about the Healthy Futures program, visit us at dbh.dc.gov and click on Children, Youth, and Family Services. See you at the summit.